Hi, this is RADHU and I'm a medical student. Today we are going to discuss about sinusitis. Before knowing what is sinusitis, we have to know what is sinus. Sinus is these are all the sinuses. There are anterior group of sinus and posterior group of sinus. They are paired. They are two in numbers. Anterior group of sinuses are frontal sinus. Frontal sinus is here. In the forehead, we have frontal sinus. It is paired. Above the eyebrow, in the forehead, we have two frontal sinus, and medial to the eyes, we have anterior ethmoid sinus, and in the cheek, we have maxillary sinus. Here you can appreciate it. Frontal sinus, anterior ethmoid sinus, and maxillary sinus is it in the cheek. Here anterior ethmoid sinus is medial to the eye, and in forehead we have frontal sinus. In posterior we have posterior ethmoid sinus and sphenoid sinus. Posterior ethmoid sinus and sphenoid sinus. All these are paired, and it also secretes in the nasal cavity. Nasal denotes nose. It also secretes in the nasal cavity. So we call it as paranasal sinuses. They are called paranasal sinuses. These are all the structure of anterior and posterior sinuses. Sinuses is a hollow cavity in the skull is filled with air. It is in the facial skull which is filled with air. This is about structure and what is the function of it. Why do we have sinus? Sinus lightens the skull and it resonating chambers for voice, and it is a resonating chamber for voice. We have some deep voice and a loud voice. All these are helped by sinuses. Then it moistens the nasal cavity. As I said, it is draining through the nasal cavity. It also moistens the nasal cavity. It produces fluid secretion to the nasal cavity. It have some glands, and through that it produces fluid which is secreted in the nasal cavity. So it moistens the nasal cavity by producing fluid from glands. These are all the functions of sinuses. Now we know what is sinus and why do we have and where it is present. All these three we know now. Now we have to know what is sinusitis. What is sinusitis? Sinusitis, it is ever refers to inflammation. It is ever refers to inflammation. Here sinusitis mean sinus inflammation. Inflammation of sinus is called sinusitis. Now we will discuss what is sinusitis. Is everyone clear about sinus? Structure of sinus, why do we have and where do we have it? It's in the forehead, medial to the eyes, and in the cheek, and it is paired. There are two in types, anterior and posterior. Now it's about sinusitis. Normally it is a very useful structure, but it becomes problematic when infection starts and when it starts inflamming. So this is about sinusitis. It is, I told you already, it is inflammation. Sinusitis is inflammation of sinus, and here are the types of sinusitis. That is types of sinus. Here is the types of sinusitis. It is abnormal. It is not a normal one. Got infected. It is infected. Types. They are acute sinusitis and chronic sinusitis. Acute sinusitis and chronic sinusitis. How do we differentiate? If the symptoms present less than 4 weeks, it is called acute sinusitis. If the symptoms persist for more than 12 weeks, here the duration differs between acute and chronic. Duration differs. Less than 4 weeks is called acute sinusitis, and more than 12 weeks is called chronic sinusitis. Etiology. It's types of sinusitis, and here is the etiology. What are all the causes? Why do we get sinusitis? Etiology is, the main one is viral cause, and the next is bacterial cause. Bacterial cause, in that we have many bacteria causing sinusitis, but the one which is most important, which is most common is Streptococcus pneumonia. It is the most common bacteria which is causing sinusitis. Other are Staphylococcus aureus, Streptococcus pyogenes, Klebsiella pneumonia, and Haemophilus influenza. All these are other types of bacteria. And obstruction to sinus ventilation, and drainage because of nasal polyp, nasal packing, and deviated septum. I told you the secretions drains through the nasal cavity when nose get obstructed. Obstruction to sinus ventilation. When nose get obstructed, ventilation to sinus also get obstructed. And drainage, it has to drain through the nasal cavity, but there is an obstruction. How we get it? It's because of nasal polyp. Nasal mean nose, and polyp is a extramuscular structure which is present within the nasal cavity, like these bubbles. It's like bubble which is present in the nasal cavity. And packing is usually a treatment for stopping bleeding. They do packing, nasal packing. It also stops secretion. Deviated septum. This is the septum in the nasal cavity. It is the septum in the nasal cavity which divides nose into two nostrils. We have two nostrils, and here is the septa which divides two nostrils. Here are two nostrils. This is the proper position of the septa. Deviated septum is it deviated. So here is the deviation. When we get deviation, there is a obstruction. Can you appreciate? Drainage cannot flow normally. Here is the obstruction. This is the deviated septa. So we are left with some other causes of sinusitis. In etiology, we are continuing the same etiology. Other causes of sinusitis are environmental factors like cold climate, smoke, dust, and pollution. Then poor general health, in which poor immunity. Poor immunity means immunocompromised. And swimming, diving. Why it is the cause of sinusitis is, in swimming and diving we will have the infected water which enters into the nose, and it affects also the sinus. Then these are all the causes of sinusitis. We are going to learn what are all the symptoms of sinusitis. Nasal congestion. We know that nose is the main part of sinusitis, and nasal congestion is present. Blockage, nasal congestion, it is due to the secretions which normally will be fluid. It is thin fluid, but in sinusitis, when it becomes infected, when it is inflamed, we have thick mucus secretion. Because of the thick mucus secretion, we have nasal congestion. Normally we have fluid, very liquid in form, very fluid in form secretion, drainage from the nose. In sinusitis, we have that very thick mucus secretion that leads to nasal congestion and pain, pressure and tenderness around the sinuses. Where all are the sinuses we have, there we have pain, pressure and tenderness. Then reduced sense of smell. Reduced sense of smell and bad breath. Bad breath is called halitosis. In medical term, we used to call it as halitosis. Then about pain, pressure, tenderness around sinuses, that mean here the forehead, in the maxillary sinus and in the anterior ethmoid sinus, here we have pain, pressure and tenderness. Tenderness is when we palpate, when we do deep palpation, that is when we touch too much deep, we will have the pressure, we will have the pain, that is tenderness. Then reduced sense of smell and bad breath is over. Toothache. Why everything got rubbed? Okay. Maxillary sinusitis. In maxillary sinusitis, we have toothache. We know that maxillary sinus is present in the cheek and below that we have tooth. Mainly, which toothache we have is premolar, that is second premolar and first molar. Molar is the teeth which we have behind, which is in the last, and there are 3 molars in that first molar, and the teeth before the first molar, which is called premolar, second premolar. These both will be affected more because of the maxillary sinusitis, and we will get toothache. So when doing tooth extraction, we must be very careful when we are doing tooth extraction, because if we extracted these tooth, it directly penetrates into the maxillary sinus. It leads to maxillary sinus inflammation more. It also increases the sinusitis of the maxillary sinus. This is about causes and symptoms of sinusitis. Here is the diagnosis of sinusitis. Diagnosis: tenderness felt by physical examination. I told you we have tenderness around the sinuses if it is inflamed or it is infected. So by physical examination, that is by feeling the pain, whether they have tenderness or not, by palpating, by deep palpation, we can find. Even that is one of the diagnosis. And next we go with rhinoscopy. Rhino refers to nose and scopy is to visualize. So rhinoscopy, through scope we visualize the nose using rhinoscopy. And nasal endoscopy, with the camera we go into the sinuses and we will find how about the secretions, what are all the sinuses which is damaged, that can be found. Next, allergy skin test. Allergy skin test is mainly to find the allergen. Which allergen is causing this sinusitis? Some will have sinusitis because of cold, because of dust and pollution. What is the dust? What is the polluting agent which cause sinusitis? To find the allergen, allergy skin test is done. Next, X-ray, CT and MRI. These are in severe cases, and when it damages the bone, surrounding bone, we will use this X-ray, CT and MRI to visualize much more deeper. Then treatment of sinusitis. This is mainly we are focusing about acute sinusitis, that is less than 4 weeks. In acute sinusitis, decongestants. We try with the decongestants. Next, corticosteroids. To reduce the inflammation, we use corticosteroids like budesonide and beclomethasone. Budesonides are used. Analgesic to relieve from pain. To relieve the pain, we use analgesics. They are aspirin, acetaminophen, ibuprofen, aspirin, acetaminophen. Next, steam inhalation. By steam inhalation, we can also reduce the inflammation. Next, chronic sinusitis. Chronic sinusitis is persistent sinusitis that is more than 12 weeks. For more than 12 weeks, all these doesn't work. And moreover, chronic sinusitis is we have treated with all these, we have tried all these, but even though it is not cured, so in that case we go for next treatment, that is what is the underlying cause. We found it using the diagnosis. What would be the underlying cause? If it is polyp, I told you nasal polyp causes obstruction and that leads to sinusitis. So polyp, like polyp and nasal septum, deviated nasal septum of septum, that the straight septa has crossed, that causes nostril obstruction. Okay, that is nasal septum deviation. All these must be treated in chronic sinusitis. If we treat this only, we can prevent from sinusitis. The upcoming sinusitis we can prevent and we can cure. Next, FES. FES is functional endoscopic sinus surgery. Functional endoscopic sinus surgery. Endoscopic, that you know, we use camera inside the nose, it goes to the sinus, and sinus is the structure and surgery. What is function? Functional. Why do we have this functional? Functional is the main functions of the sinuses must be restored. If we do surgery, we should not damage the normal function of sinus. So normal function is maintained. That is moistening the nasal cavity, resonating the voice, all these must be maintained. For that, functional endoscopic sinus surgery is done. That is about, this is the most important surgery. So remember this name very well. Next, other procedures. When everything fails, we don't have any other choice, we go for the old procedures, which is Cardwell look antrostomy. This is for maxillary sinusitis. Maxillary sinusitis in the cheek, maxillary sinusitis. So Cardwell look antrostomy is used. Next, trepanation of frontal sinus. This is for frontal sinus. All these are external surgeries. That is, they make some hole here in the frontal. If here is the frontal sinus and it is too much infected and everything, all other treatments failed, here we put a hole and then we drain all those very thick secretions, all those we will remove, all those, that viruses, bacteria, everything will be removed using this trepanation and Cardwell look antrostomy. These are all the other procedures. Then that's all. This is about sinusitis. First we discussed about sinus, structures of sinus, where it is present, why do we have it, and next, if it gets inflamed, what are all the problems we face, and some diagnosis and treatment. So thank you so much. Please like, share and subscribe, and also comment. Both positives and negatives, everything is welcomed. Thank you so much.